Good evening, everyone. Thank you for being here and taking the time to come and hear me out. My name is Brittany Campbell, and today we're going to be going over personality disorders, how that comes into play with pharmacology, and then also our role as social workers. So here's what you can expect. A brief introduction. We're going to go over personality disorders, give you an overview. We're going to talk about the different clusters of personality disorders. Then we're going to talk about medication intervention for them, alternative interventions other than medication, what our ethical responsibilities are, what the limitations are when it comes to medication, and then we'll talk about alternative to pharmacological treatments a little bit more detailed. So here we go. So the idea is I'll be aiming to assist with the assessment, intervention, and evaluation of individuals, families, groups, organizations, and communities. This presentation will walk through the assessment of personality disorders and exploring practical application of interventions, both pharmacologically based and just regular based intervention without medication and that nature. And I'll also assist in the evaluation of practice with clients as you explore what interventions to utilize if one type of intervention doesn't seem to be assisting the client. So personality disorders, here's an overview. Um, so, like I mentioned, there's different clusters. So the first cluster is cluster A, and they're considered odd or eccentric disorders. Paranoid personality disorders going to fall under there. Schizoid personality disorders under cluster A, as well as schizotypal personality disorder. I won't give you guys all the details, go over that. This slideshow and information will be available to you guys afterwards. So if you want to look over it more in depthly, then we move to cluster B, which is categorized as dramatic, emotional, or erratic disorders. First one of that, which I'm sure many of you have heard of, is borderline personality disorder or BPD. Then you're going to move over to antisocial personality disorder. And then you're going to have narcissistic personality disorder. And then lastly, you're going to have histrionic personality disorder. Um, they're all got their own characteristics. They're all very specific and they're important to know. Then you're going to have cluster C, which is mostly categorized as anxious disorder. So avoidant personality disorder. Then you've got dependent personality disorder. Then you've also got obsessive compulsive personality disorder. And then with these, each personality disorder presents unique challenges and patterns of behavior that require specialized approaches for effective management and treatment. And so overall, personality disorders are a category of mental health disorders characterized by enduring patterns of behavior, cognition, and inner experience that deviate from the expectations of an individual's culture, leading to distress or impairment. They are typically divided into these three clusters, as I mentioned before. So here's where we come to specific medications for personality disorders. These are going to be the most common listed here. So you've got your antidepressants, your antipsychotics, your benzodiazepines, your mood stabilizers, and then there's also tertiary treatments. However, they're very limited and ones that are specific tertiary medications for personality disorders. So medications for personality disorders are not typically the first line of treatment, but they can be used to manage specific symptoms. The primary medications used include antidepressants and antipsychotics. Antidepressants can help manage symptoms such as depression and anxiety, which are often associated with personality disorders. Antipsychotics may be used to address symptoms like mood swings or impulsivity, particularly in disorders such as BPD, borderline personality disorder. Um, Secondary treatments might include benzodiazepines for acute anxiety, management, right? And mood stabilizers to help with emotional regulation. However, these medications should be used with caution due to the potential for dependency and side effects. It's important to note that while the medications can help manage certain symptoms, they do not address the core issues of personality disorders, which often require long-term psychotherapy and other non-pharmacological interventions. So here are some alternatives to medication. They're usually recommended anyways with medication. Um, so we've got, of course, long-term psychotherapy, and that is in the form of dialectical behavioral therapy, which is a form of CBT, and then, of course, CBT, which is cognitive behavioral therapy. Some other interventions that might be suggested are mindfulness and stress management, and of course, lifestyle changes. So that means, changing up their diet, including exercise, things of that sort. So alternative interventions for managing mental health disorders often include long-term psychotherapy. It's common across the board, right? Such as DBT therapy and CBT. These therapies are particularly beneficial for individuals with personality disorders and mood disorders. DBT is designed to help individuals manage emotions, improve relationships, and reduce self-destructive behaviors. It is especially effective for those with borderline personality disorder. CBT, on the other hand, focuses on changing negative thought patterns and behaviors, making it a versatile treatment for various mental health issues, including depression and anxiety. Both therapies emphasize the development of coping skills and emotional regulation, right? Which are, of course, crucial for long-term recovery and symptom management. So for personality disorders, there's no specific dietary medications, as I mentioned before. Instead, dietary treatments usually focus on non-pharmacological interventions such as stress management, exercise, and dietary changes. These approaches aim to support overall well-being, which is important, and symptom management rather than directly targeting the disorder itself. The emphasis is on therapies and lifestyle modifications that can aid in long-term recovery and symptom control. So it's important to note that while medications can help manage certain symptoms, they do not address the core issues of personality disorders, which often require long-term psychotherapy and other non-pharmacological interventions. You'll hear me mention that a lot because it's important. So here, we're going to touch a little bit on us as social workers and what our responsibilities are ethically. So, of course, we've got our 6 core values of the Code of Ethics for you guys to see as a reminder. It's important to always touch on social welfare, public participation, public emergencies, social and political action. And then here we kind of need to touch also on what implications come from over medication, things like pill mills and big pharma. So as social workers, we play a critical role in navigating these complex issues by advocating for ethical practices and medication management, supporting clients in assessing appropriate therapies and addressing the systemic issues that contribute to over-medication and the misuse of pharmaceuticals. So we also work to educate clients and communities about the risks associated with these practices and advocate for policy changes that better regulate pharmaceutical industry and support holistic approaches to mental health care. Overall well-being is crucial. It's the main goal, overall well-being. So we're trying to support holistic health with mental health care. What are some limitations of medications for personality disorders? Kind of already touched on this a little bit, but it's important to mention it again. So it poses as difficulty in addressing like the core symptoms. A lot of times medications are just like for general relief, not the core symptoms. There's a potential for dependency on medications. That's with any medications, but especially with benzodiazepines. Benzo addiction is real. And lastly, there's also the possibility of side effects and long-term health risks with continued use of these particular medications. So our best alternative to pharmacological treatment is, of course, DBT therapy, so dialectical behavior therapy, because it aims to enhance emotional regulation and interpersonal effectiveness. And it's proven by evidence-based success that it does reduce self-harm and improve emotional regulation overall. So we want to keep at that. We want to keep helping our clients get to that and get DBT as much as possible when they are dealing with things with like personality disorders. So here is where we'll go over the key things again, right? So the idea was that this helps to cover the necessary aspects of assessing, intervening, and evaluating personality disorders in individuals, communities rooted in both pharmacological and alternative methodologies. We also remember the importance of personalized treatment plans because every individual is different. How the personality disorder represents itself is going to be different, right? And then we need to also remember our role as social workers with ethics and anything that we choose to have as an intervention, right? So personalized treatment plans are crucial in social work because they allow for tailored interventions. They address the unique needs and circumstances of each client. This approach ensures that clients, receive the most appropriate and effective support, which can lead to better outcomes in their mental health and overall well-being. There's that overall well-being again, right? Um, so personalized plans consider various factors such as the client's background, specific challenges, the personal goals, and all of that can significantly enhance the effectiveness of said treatment. So personalized overall well-being. Can't say that enough. Because, that's part of our job, and we would want that for ourselves also. So social workers obviously play a vital role in ethical intervention by acting as advocates for our clients, especially in situations where their rights may be violated when they face systemic injustices, right? You can see that a lot going on in our world right now. We're responsible for promoting social justice and ensuring that clients have access to necessary resources and support. Always, 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 always. This includes helping clients navigate complex systems such as healthcare and legal systems and advocating for fair policies and practices. Social workers also address ethical concerns related to over-medication and the influence of pharmaceutical companies, ensuring that clients are informed about their treatment options and the potential risk involved. They know both sides, right? All of their options, what it could do for them, what it may not do for them, and also what risk it could bring. They need to be informed, and it's part of our job to do that. I think it's just important to remember that there always are options and there always are resources for our clients. And I hope that this allowed you all to get a better understanding of how you should do that with clients that are oh my goodness, specifically, I can never say that word, apologies, deal with personality disorders. Again, I thank you for being here and your time. If you have any questions, feel free to throw them at me now. I'll also leave my information with everybody and provide the PowerPoint to everyone. Thank you.